Hello everyone, thank you so much for tuning into our presentation today on the anti-inflammatory diet. My name's Claire, I'm one of the registered dietitians at the Cancer Center, and Anna will be jumping in a little bit. She's also a dietitian at the Cancer Center. So we're going to talk about a topic that can be beneficial for everybody, and that is the anti-inflammatory diet. So our objectives today are going to be, we're going to be able to define inflammation, and we'll learn a little bit about the two types of inflammation, both acute and chronic inflammation. We'll explore the connection between inflammation and cancer. We'll learn about what constitutes an anti-inflammatory diet, and diet and lifestyle steps to reduce and prevent chronic inflammation. So you will leave with some practical nutrition tips that you can try at home and some tasty recipes that are anti-inflammatory. Okay, so what is inflammation? Inflammation is the body's natural response to protect itself against harm. You may all be more familiar with the acute type of inflammation, which happens when you bang your knee or when you cut your finger. When you cut your finger, your body will send inflammatory cells to the injury, and this will start the healing process. The result can be pain, it can be redness, it can be swelling, it can be bruising. In these settings, inflammation is actually very crucial, and without it, simple injuries or infections could actually fester and become very dangerous. The goal of acute inflammation is to respond to the stimulus and restore balance in the body. Chronic inflammation, on the other hand, is more of a longer-term physiological response, and it could last months, it could last even years to one or more factors or stimuli. Some of these stimuli could include things like ongoing exposure to environmental toxins, so things like cigarette smoke, industrial pollutants or allergens. It could be from microbial or viral infections. It could be related to poor nutrition or ongoing poor diet, chronic stress, and processes related to aging. So because this happens internally and gradually over time, the signs of chronic inflammation are a little bit more subtle. So chronic inflammation is a risk factor for a variety of diseases. As you can see on this slide, may have more increased risk for diseases such as cardiovascular disease, Alzheimer's, diabetes, arthritis, autoimmune disease, neurological disease, pulmonary diseases, and cancer. Some examples of where we see viral or bacterial infection leading to chronic inflammation and then therefore increased risk of cancer could include infections such as H. pylori, which could lead to inflammation of the stomach and therefore gastric cancer. Another example is human papillomavirus, or HPV, which can lead to chronic inflammation of the cervix and then leading to cervical cancer. So what is this process of acute to chronic inflammation? One, you have your tissue damage from one of those stimuli that we just reviewed. Then you have your inflammatory response, which is triggered, and your immune cells will go to the damaged site and release mediators and inflammatory cells and what we call reactive oxygen species, and these pro-inflammatory cytokines to eliminate the pathogen and repair the damaged tissue. So if the acute phase does not eliminate the pathogen resolving the inflammation, the inflammatory process will continue and can develop into a chronic condition. So chronic inflammation is activated when the mechanisms of acute inflammation fail to heal an injury. So if we leave this unchecked, prolonged inflammation generates a series of reactions that can damage cells and eventually lead to the clinical symptoms of disease. Here are some markers of inflammation that you can test for in the body. So there's a variety. You may all be familiar with C-reactive protein because it's often ordered in a cardiovascular risk profile. Noted that this can actually acutely increase during an infection or stress or injury, but is considered a good marker of inflammation in the body. This diagram shows a variety of risk factors that may lead to a cascade of events that, if left unchecked, can promote chronic inflammation and may promote cancer development.
Thank you, Claire, for that great introduction on the inflammatory process. Next, I'll talk about the nutrients and how it affects the inflammation and its effects on inflammatory markers. In this class, we'll talk about how the Mediterranean diet pattern can decrease the overall inflammatory markers, how saturated fat can increase it, how trans fat can increase it, how monounsaturated fat omega-9 such as avocado and olive oil is neutral or potentially decrease it, high omega-6 to 3 ratio can increase it, high glycemic index carbohydrates can increase it, how fiber can decrease it, and how vegetables, fruit, flavonoids, carotenoids, antioxidants, and magnesium can decrease it, and how alcohol is moderate, potentially low, but if in excess, it can increase it. So in looking at the Mediterranean diet pattern by Dr. Willett, we see that the base is exercise, and then followed is fruits and vegetables, whole grains, nuts and seeds, and then seafood and fish. And then we have a little bit of poultry and eggs, and a small part of meats and sweets on the top. Wine in moderation, and then plenty of water. Similarly, in Dr. Wheel's anti-inflammatory food pyramid, we see that fruits and vegetables are at the base, and then we have whole grains, pasta, beans, fish and seafood in the middle, and then he adds mushrooms, supplements, and then some herbs and seasonings, red wine again at the top in moderation, and a little bit of sweets. So both of these pyramids are low in saturated fats, low in trans fats, low in refined carbs, and high in whole grains, fruits and vegetables, and fish and seafood. Saturated fats are primarily found in animal fats, processed meats, and butter. Trans fatty acids, for the most part, has been removed in the food system, but can be found in processed foods. Studies including the Nurses' Health Study and the National Healthy and Nutrition Examination Survey and more have shown increased inflammatory markers such as C-reactive protein, interleukin-6, and E-selectin levels when eating more red and processed meats, sweets, French fries, and refined carbohydrates. Red and processed and charred meats and deep-fried foods are major sources of these fats and compounds, such as nitrosamines, HCAs, and PAHs that have been associated with higher risks of various cancers. Essential fatty acids, omega-6 and omega-3, are essential for growth and development. However, we can't manufacture it in our bodies, so we need to have it from food. The function of omega-6 fatty acids is that it converts into eicosanoids. Now, these are hormone-like compounds such as prostaglandins, thromboxanes, and leukotrienes. And the function of these is that they are influencing in blood pressure, immune system, perception of pain, susceptibility to allergies, inflammation, and more. So as we mentioned, omega-6 and omega-3 are essential, but it's really having that right ratio between the two. If there's an imbalance of omega-6 to omega-3, they can have negative effects on the metabolism of prostaglandins. The standard American diet ratio of omega-6 to omega-3 is 14:1, but the traditional or ideal ratio is 4:1 or even 1:1. So how do we go about changing that ratio? We recommend decreasing the omega-6 fatty acids, such as meats that are grain-fed, butter, whole milk, egg yolks, sunflower oil, safflower oil, processed foods made with these oils, because these are pro-inflammatory compounds. They promote inflammation and they suppress the immune function, thereby promoting disease. We recommend increasing the omega-3 fatty acids, so increasing the EPA and DHA that's in cold water fish, such as wild salmon, trout, sardines, herring, and sablefish, and increasing the ALA in flax seeds, chia seeds, walnuts, and pumpkin seeds, because these are anti-inflammatory. They lower the expression and secretion of pro-inflammatory protein and are immune-enhancing. So the omega-3 fatty acids increase production of anti-inflammatory and inflammation-resolving resolvins from EPA and DHA. What that means is that these inflamed tissues are able to go back to homeostasis. So they're able to go back to their normal state and not in that acute inflammatory state. So we wanted to delve a little bit more about the omega-3 fatty acids and their relationship to cancer. Studies report omega-3 fatty acids may reduce some of the cancers. It helps to reduce cancer cachexia, which is weight loss. And cancer cachexia, there's increased inflammation and increased muscle protein degradation. It also acts to enhance immune function. The omega-3 fatty acids, once incorporated into the cell membranes, can substitute for arachidonic acid, which produces less free radicals. It shifts production of prostaglandins to a less immunosuppressive variety. It decreases suppression due to chemoradiation therapy as well. So to summarize for the healthy fat recommendations, we recommend keeping saturated fats to less than or equal to 7% of the total calories by limiting or avoiding fatty meats, whole milk dairy products, egg yolks, cheese, mayonnaise, butter, and baked goods. Choose grass-fed meats and omega-3 enriched eggs to lower saturated fat and omega-6 fat intake. Avoid trans fats. Reading food labels and ingredient lists, avoid any foods that contain any partially hydrogenated oils. And aim to a 1:1 to a 4:1 omega-6 to omega-3 ratio by limiting processed foods. And if you're eating out, inquire about the type that is used in the restaurant. Increase sources of omega-3 daily by using ground flax seeds, chia seeds, walnuts, pumpkin seeds, and cold water fish about 2 or more times per week. EPA, DHA, or fish or algae oil supplement if appropriate. And use monounsaturated fats that are neutral, such as extra virgin olive oil, avocado, almond, macadamia nut in cooking and in meals. We can boost omega-3 fatty acids pretty easily. You can add chia seeds or ground flax seeds to just about anything in oatmeal, yogurt, smoothies, or salad. A tablespoon of ground flax seeds is about 1,600 milligrams, and a tablespoon of chia seeds is about 2,500 milligrams. You can incorporate salmon about 2 times a week. A serving size of salmon is about 3 ounces, and that gives about 1,570 to 1,830 milligrams. Sardines you can have about twice a week. 1 can is about 1,400 milligrams. And snack on walnuts daily, about 14 halves is about 1 ounce, which is about 2,500 milligrams. The adequate intake for ALA found in plants, chia seeds, flax seeds, and walnuts is about 1,100 milligrams for women and 1,600 milligrams for men. The National Academies haven't issued a daily nutritional requirement for EPA and DHA yet.
There is also an association between inflammation and high glycemic index foods. So glycemic index is a value that's assigned to foods based on how quickly it raises our blood sugars in the body. So you see here on the diagram, the left side indicates a higher glycemic index food. So you can see that your blood sugars rise really quickly and then they fall very quickly. Versus on the right-hand side, those would indicate a more lower glycemic index food, meaning that your blood sugars rise a little bit more steadily and drop a little bit more steadily. The goal is that you want to try to have as balanced of blood sugars as possible and try to minimize these peaks and these falls. Here are some examples of some higher glycemic index foods. On the left, you have your refined grains or cereals that contain sugars will make your blood sugars rise a lot more quickly versus your lower glycemic index foods, which include things like fruits and vegetables and whole grains and beans. What is the relationship between glycemic index and inflammation? So high glycemic index carbohydrates appear to promote inflammation by increasing our blood sugar levels and thus increasing insulin levels, which can increase our liver's production of C-reactive protein. It may also lead to increased body weight or central adiposity, which can increase these inflammatory cytokines in the body. Some studies show that there's an association between high glycemic index foods and a high glycemic index diet and increased risk for cancer. However, these results are mixed. What are some dietary strategies we can take to lower this glycemic load? One thing that we can do is to try to have a very high fiber diet. So goal is about 30 to 45 grams of fiber a day. This may be very difficult for some people if you have digestive issues or having side effects that may make it hard for you to digest fiber. But there's a lot of strategies you can take, such as cooking your vegetables or blending them in a soup or a smoothie. Just a few examples. You're going to be getting your fiber from increasing your vegetables, your beans and legumes, and your whole grains. Trying to limit our portions of starchy carbohydrates as well, and we'll go over what we recommend our portions to be on a plate. Replacing these white foods, so things like white rice and white pastas, added sugars, and choosing whole grains instead. Replacing sugar-sweetened beverages, specifically avoiding beverages containing high fructose corn syrup, and choosing water, sparkling water, or spa water is a good strategy, so adding cucumber or mint. Avoid eating starches alone. So when you are consuming starch, trying to pair it with protein and fiber and fat. So a good example I like to say is if you have 2 pieces of whole wheat bread and one you just eat plain and then the other you add avocado, which is a healthy fat and adds fiber, and then you also add an egg on top, which will give you protein, your blood sugars won't rise as much when you add these other ingredients. So very important to pair your starches with other foods as well. Avoiding evening snacking can help, and your evening size meal, reducing that size, and exercise. So these are all good strategies, and I know this may seem like a lot of strategies, but even if you choose just one to focus on, you're going to be making a big impact in your blood sugar levels. So this illustrates a healthy plate and the portion sizes of our food groups to help maintain healthy blood sugars. So you can see that half of your plate is primarily these non-starchy vegetables, and then you have a quarter of your plate as your lean animal or your plant protein, and then your last quarter of your plate as your whole grains and starchy vegetables. You can see that we do want to include whole grains and starchy vegetables in the diet. They are part of a healthy diet. It's just more so about portioning them out on your plate and choosing the right types. We mentioned a way to lower that glycemic load is to choose higher fiber foods. It's always really helpful to check the nutrition label when you're buying things like breads or cereals to see how much fiber does it provide. So if you're taking a look at this nutrition label, you can see that there is 4 grams of fiber per serving size. We do suggest trying to buy cereals and breads greater than 3 grams of fiber per serving to get the most benefit. It can also be really helpful to look at the added sugars as well. This one includes 0 grams of added sugars, which is a pretty healthy cereal that we would recommend. Here are some examples of some fiber in some selected foods that we chose, and you can see that beans really provide a lot of fiber in the diet. Just a half a cup cooked can get you almost a third of your fiber goals for the day. So really encourage things like beans and legumes. Things like whole grains like quinoa provides a good amount of fiber, and these fruits and vegetables. Finding whole grains in your bread as well. We always encourage looking at the first ingredient on the food label. So you can see here on the left, you have your organic sprouted wheat. We do encourage trying to find either whole wheat or sprouted wheat, as this will contain a lot more fiber and it uses the entire kernel. So it'll have a lot more benefits than your more refined starches, such as on the right side where you see enriched flour. We also wanted to touch on physical activity. So physical activity in any form can help reduce your risk of cancer and has been shown to be very anti-inflammatory, so can actually lower your levels of C-reactive protein. In cancer survivors, exercise has been shown to also decrease fatigue, anxiety, and depression, so very, very good for mental health, boosting self-esteem and happiness. So any type of physical activity is great. It could be walking or jogging, it could be strength training, could be stretching, could be balance. So all types and cumulative are very encouraged. Exercise and breast cancer. There's been a lot of research showing that exercise may actually lower risk of recurrence. Specifically, studies have shown that 1 hour per week may reduce risk of recurrence by 20%, 3 to 5 hours per week possibly with a 50% lower risk, and 5 hours per week, 44% lower risk. So we really have been seeing in the research these benefits of exercise. Vitamin D is also something we wanted to touch on. So vitamin D is a fat-soluble vitamin found primarily in fatty fish, found in a lot of fortified products and milk, and we also generate vitamin D through sunlight as well. And the benefits of vitamin D among many inflammatory conditions, so shown to be very anti-inflammatory, can help with your bone health, with heart disease, infections, and multiple sclerosis. So vitamin D levels have been linked to increased cancer survival. So trying to have your levels ideally between this 40 to 60 range can be very protective. So we always encourage asking your doctor to check your vitamin D levels and then can offer a supplement based on your lab results. So what is this mechanism of action with vitamin D in cancer? There's many, but to name a few, may promote apoptosis, so in other words, cell death. It can also downregulate genes which have been shown to be linked to cancer. So for example, the COX-2 gene, it may lower that expression, which has been shown to have an increased risk for colorectal cancer formation. So although we consider greater than 30 a normal range for vitamin D, like I mentioned, we do want to try to aim for that 40 to 60 range if possible. So we recommend getting your levels checked, and then we can offer a supplement based on your levels. We also wanted to talk about food allergies and sensitivities and its relationship to inflammation. So here are a few of the most common major food allergens, which are milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, and soybeans. So if you tolerate these foods okay, there's no reason to eliminate them. But if you do have an allergy to one of these foods, we do recommend trying to limit consumption just to reduce risk of inflammation.
So next we'll talk about the vegetables and fruits and how it affects the inflammation. As we mentioned earlier in the two pyramids, they have the fruits and the vegetables at the base of the pyramid because it's high in anti-inflammatory properties. Scientists estimate cancer risk can be reduced by about 30% with a diet rich in plant foods. These provide vitamins, minerals, dietary fiber, and phytochemicals. Organic fruits and vegetables increase phytochemicals because it has lower pesticide residues. High intake of fruits and vegetables lower the risk of inflammatory markers and inflammatory cytokines. Laboratory studies have shown that phytochemicals have the potential to stimulate the immune system, block substances we ingest from becoming carcinogens, reduce the kind of inflammation that encourages cancer growth, and reduces the kind of oxidative damage to cells that can spark cancer, such as antioxidants. These phytochemicals are found in anti-inflammatory foods, which are found in colorful fruits and vegetables, which is why we say eat the rainbow. Quercetin can be found in apples. Resveratrol can be found in berries and grapes. Indole-3 carbonyl and sulforaphane can be found in cruciferous vegetables. Silymarin can be found in dried milk thistle fruit. Curcumin can be found in turmeric. Dialysate sulfate can be found in garlic. Carotenoids can be found in pumpkin and sweet potatoes. And lycopene can be found in watermelon and tomatoes, to name a few. Vitamin E, lignans, phenolic acid, and phytic acid can be found in whole grains. And isoflavones can be found in soy. So these herbs and spices can be a great way to spruce up the flavor of your foods, but they also have good anti-inflammatory properties and immune-boosting properties. So we have garlic, cinnamon, red pepper, black cumin, parsley, fennel, turmeric, ginger, cloves, and fenugreek. There's a great way to spruce it up in vegetables, putting it in meats or in fish. You can even use it as a tea, putting turmeric, ginger, and black pepper together. And cinnamon is a great way to make things sweet without adding sugar. So our top anti-inflammatory foods are all spices and herbs, cherries and berries, leafy green vegetables, cruciferous vegetables, pumpkin, butternut squash, yam, and carrots, tomatoes, onions, celery, artichokes, and soybeans, olive oil, tea, dark chocolate, which has plenty of flavonols, magnesium-rich foods like nuts, legumes, and whole grains. So I want to talk about these traditional anti-inflammatories. There are many studies underway on traditional herbs used as anti-inflammatory agents. I just want to mention it's good to talk with your doctor if you're taking any other medications to see if there are any interactions, in particular with blood thinners. To summarize, I wanted to talk about the healthy anti-inflammatory lifestyle. We can increase vegetables and fruits by having 8 to 10 servings daily, herbs and spices with everything, fiber about 30 to 45 grams daily as tolerated, healthy fats like cold water fish 2 to 3 times per week, flax seeds, chia seeds, walnuts, extra virgin olive oil, avocados, and almonds, green tea 1 to 4 cups daily, vitamin D, try to achieve greater than or equal to 30 nanograms per milliliter, physical activity daily at least 30 minutes, processed foods, refined grains, flours, sugars, and fats you want to limit or avoid, meat and dairy, limit or choose grass-fed if eating, alcohol, limit to less than 2 servings per week. A standard alcoholic beverage is 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of hard liquor. And food allergens, avoid. Now, I know it's hard for some people to have all of these all at once, so we recommend having 1 to 2 goals daily and then working your way up. For some people who have already done many of these, that's really terrific. We recommend maybe doing 1 or 2 more goals if you can. We really hope at this time that you're able to really embrace the anti-inflammatory lifestyle with the tools that we provide for you today. So I want to leave you with some words of wisdom by Hippocrates. Let food be your medicine and medicine be your food. Another practice precaution is to always discuss changes with your diet and supplement with your healthcare provider. And always balance a healthy diet with regular exercise, relaxation, and laughter. And here are the references.
Okay, so now we're going to transition into our food demonstration, and we are going to make 2 recipes for you. One is our chia pudding, and then our other is our curried hummus, but it's a more express, quicker version. You'll be able to find these anti-inflammatory recipes down in the description below the video if you're looking for some more anti-inflammatory recipe ideas. But let's get started with chia pudding. So chia pudding is a great breakfast idea because 1, it takes about a minute to prepare the night before. And it's really high in those omega-3 fatty acids that Anna was talking about, which are very anti-inflammatory. So for chia pudding, you need your chia seeds, you need any type of milk. So we are using an almond milk today, but you can really use any milk that you'd like. And your additives. So we're going to use some cinnamon just to make it taste a little bit sweeter and give it a good spice, and then any toppings that you'd like as well. We're using blueberries today. So we're going to add about 1/2 cup of these chia seeds into a bowl. Put it in a bowl. And then next you add your almond milk. And like I said, this is an unsweetened almond milk, a great option. Do you like using any other milks in your chia pudding? Or
Yeah, I like almond milk. Sometimes there's also macadamia nut, cashew milk.
Yeah, all great options. So we're going to do 2 cups. And this recipe yields 2 servings. So that. And then we're going to add some cinnamon. Vanilla extract also works really, really well in here to give it a little bit of flavor. We didn't have that today, but really great ingredient to put in here. And just mix it all together. And that is it. So that's how you make chia pudding. And if you let it sit overnight in the refrigerator, it will do its thing overnight and become a pudding-like consistency. So we actually made one last night and wanted to show you what it would look like. But you can see it has more of this pudding consistency. And I really like to top mine, like I said, with berries is a great option. You can also put walnuts on top. You can put granola, really any topping that you'd like. And makes for a very healthy, high omega-3, high fiber breakfast option. So
yeah, you can also use it as a snack, or if you have a sweet tooth and you want to use it as your substitute for dessert, that's a great way as well.
Definitely. Great. And then we also have our curried hummus, which is on our handout, but we're going to show you a quicker version.
Yeah, so this is a quick and easy, just a 2-stepper. You can get some hummus that you can buy from the store and just put it in a bowl. Great source of garbanzo beans, plant protein. And then you can get some curry powder, which has the turmeric, black pepper, ginger. You can really spice it up the way that you like it, but we'll do about 1/2 teaspoon for now. And then just stir it all up. And that's really it, pretty easy. So you can just mix it up. You can have it with some whole grain crackers. You can use it as a sandwich spread. You can maybe have it with vegetables.
And we wanted to do this recipe just to highlight that, you know, you really can add spices, things like turmeric or curry powder to almost any food just to give it a little bit more flavor and a more anti-inflammatory boost. So this is a great way to do it to an already prepared food that you can, boost up and make more anti-inflammatory yourself at home. Thank you so much for joining our presentation today on the anti-inflammatory diet. We hope you got some good inspiration with some recipes, and if you are looking for more recipe ideas, feel free to visit our website, and thank you for joining.